New York Giants running back Saquon Barkley was ruled out of this Sunday's game after suffering an injury to his right ankle. Welcome back, everybody. In this video, we're going to break down what exactly might have happened with Saquon Barkley's ankle injury and run through some of the key steps that go into evaluating this type of injury. Make sure you subscribe if you like this type of content and want to stay up to date with future videos, and let's get started. Right off the bat, I'm recording this as the game is still going on, so the only official word we've seen is that he's been ruled out with an ankle injury, and we saw the images where he was on the sidelines wearing a walking boot and using crutches. So obviously pretty high concern for a serious injury here, but we don't know the official report. So let's take a look at the play where this happened and go through what might have been injured and what some of the key steps are to evaluate an ankle injury like this. Running the clip here when this happened, we can see Barkley running out to the side, and keep in mind it's his right ankle that we're talking about. So he comes down here, and the key part here is that his right foot ends up being fixed and planted into the ground. So in this position, and a lot of people were first thinking, could this be a knee injury just because of the torque and the twisting on his knee? But we of course now know to look at the ankle. So right in this position, we have a planted foot that's rigid to the ground essentially, and a player's body who is shifting away kind of out towards the sideline along with the momentum from the tackle. So as we continue to roll this here, we can see Barkley's body continue to go to the left side towards the sideline, but his foot is still planted firmly in the ground and goes into external rotation, just the way that he's being hit from the side of the knee while the foot is planted stuck in the ground. So as we continue playing here, we can zoom in and look, and if we freeze it right about here in this position, we can draw a line seeing how his knee is basically kind of pointed down in one direction, but then the direction that his foot is turned is offset a little bit to the outside. So that's what clues us into this idea of his ankle having gone into an external rotation position, along with a little bit of dorsiflexion, toes pointed up. Now, fractures in the ankle and in the foot are a totally separate thing. We're gonna see those with point tenderness on our exam. We could probably pick them up with x-ray depending on how severe they are, but oftentimes the tricky part with these injuries at the sideline is assessing the ligaments. There's three key areas of ligaments they're gonna be looking at, and let's walk through the different tests they'll do and what we should be most concerned about. The first and most common group are the lateral ankle ligaments, and those are typically injured in more of a traditional inversion type sprain, which it doesn't look like is what happens here with Barkley. You're gonna have pain here in this area just on palpation, but the main test they're gonna do is something called a Taylor tilt. They're gonna rotate the foot outward, trying to pull and stretch these ligaments. And if anything's been significantly torn, or if there's a lot of asymmetry from one side to the other, that clues in the medical team that it could be these lateral ankle ligaments that were injured. The other test we can do is called an anterior drawer test. And this is specifically trying to assess the anterior talofibular ligament that runs more front to back below in the ankle. The examiner puts their hand on the heel behind the ankle and essentially tries to distract it forward, stressing that ligament. If again, there's asymmetry from one side to the other, there's a lot of pain, there's a lot of excessive movement, it tells the medical team that potentially this ATFL ligament could be injured. The third big test they're gonna do is something called an external rotation test. And this is where we really get to the concern with Barkley about a possible high ankle sprain or a syndesmotic ankle sprain. Your ankle syndesmosis is the lower portion of the joint between the tibia and the fibula, where there's three key ligaments that help hold your tibia and your fibula together. The weakest of the three, and the one we commonly hear about with a high ankle sprain, is the anterior inferior tibiofibular ligament, but there's also a posterior inferior tibiofibular ligament, and one that also goes directly between the tibia and the fibula, kind of in the middle. So if we look at a cross section, there's actually three syndesmotic ligaments going through here that can be injured with a high ankle sprain. The weakest of these is the AITFL, but if you have multiples of them torn, that's when you get a lot of instability in that joint. The reason external rotation is thought to cause these high ankle sprains is because of the way that the talus sits in the mortise of the ankle joint. You've probably seen me describe this before, but the fibula and the tibia come down and form a mortise over the talus in the ankle. If your foot goes into a lot of external rotation, that causes the talus to turn, and as it turns, it widens that lower portion of the fibula and the tibia, which pulls on those ligaments and can injure them. Going back to the footage here of with Barkley, this is again the concern. Based on the amount of external rotation he had on his foot, we'd worry about this syndesmotic or high ankle sprain. Another exam test they'll do for a syndesmotic or a high ankle sprain is something called the tibial fibular squeeze test. What you're doing here is you're squeezing the tibia and the fibula together higher up in the leg, and what that's doing is it's putting stress down on the lower portion of that joint connection, where those ligaments are involved. If those ligaments are damaged or injured, then when you push higher up, it causes those ligaments to spread out down below. And if it's painful down below, that gives you another clue that this could be a high ankle sprain. And yes, you also have injuries to the medial ankle ligaments, the deltoid complex, but these are much less common and I don't think as big of a concern based on this mechanism. X-rays can also help if this is a high ankle sprain because it can give us some indication about how much ligament damage there might be based on specific measurements we see on the X-ray. When they get X-rays of the ankle looking from front to back, there's 3 different zones they're going to measure to try to determine how much widening or loosening there could be between the ankle joint. These 3 areas are the tibiofibular clear space, the tibiofibular overlap, and then the medial clear space. In a normal healthy ankle, there should be some separation in these areas, but if any of these ligaments get torn, then those bones can spread apart from one another and you can have increased space on those measurements. Either way though, I'm sure Barkley's gonna have an MRI to really assess the true extent of damage in the ankle. It certainly is possible that he's got a fracture that they've already picked up on X-ray, but even without a fracture, just a severe enough ankle sprain, your number one goal is to really reduce the pain and offload it. And so the fact that he's in a walking boot on crutches could simply be because there's just a lot of pain whenever he was walking on it. It doesn't necessarily indicate that they found a fracture. Stay tuned to the channel though, because later in the week, we'll provide some updated information based on what we hear about a final diagnosis. But hopefully this was educational to walk you through the injury mechanism and kind of talk a little bit about what they would do to assess an ankle injury. Thanks as always for watching everybody, and we'll see you in the next video. Bye.